Hello ladies and gentlemen, this Remedy 24. Today we are going to learn about vitamin D toxicity and the amount that is considered to be too much. Toxicity from vitamin D is relatively rare, but it can happen in high quantities. Because extra vitamin D can build up in the body, it normally develops over time. Taking large dosages of vitamin D pills is the cause of nearly all vitamin D overdoses. It's nearly difficult to obtain too much vitamin D via diet or sunlight. This is a comprehensive presentation on vitamin D toxicity and how much is deemed excessive. Number 1. How does vitamin D toxicity happen? Vitamin D toxicity occurs when the body's vitamin D levels are so high that they cause harm. Hypervitaminosis D is another name for it. Vitamin D is a fat-soluble vitamin that helps the body absorb calcium and phosphorus. Unlike water-soluble vitamins, fat-soluble vitamins are difficult to eliminate from the body. As a result, excessive amounts may accumulate within the body. Vitamin D poisoning has a convoluted mechanism that isn't fully known at this time. However, we do know that the active form of vitamin D works similarly to a steroid hormone. It travels across cells, instructing them on how to turn genes on and off. Most vitamin D in the body is stored, linked to either vitamin D receptors or carrier proteins. There is a scarcity of free vitamin D when vitamin D intake is excessive. However, the levels might rise to the point where there is no more place on the receptors or carrier proteins. This could result in higher quantities of free vitamin D in the body, which could move within cells and overwhelm vitamin D-dependent signaling systems. Increased calcium absorption from the digestive tract is one of the most important signaling pathways. As a result, the most common sign of vitamin D toxicity is hypercalcemia or high calcium levels in the blood. Calcium can bind to other tissues and cause damage. Therefore, high calcium levels can produce a variety of symptoms. The kidneys are included in this. Number 2. Optimal and excessive vitamin D blood levels. Vitamin D is a necessary nutrient, and it has receptors in practically every cell in your body. When the skin is exposed to the sun, it produces it. Fish liver oils and fatty fish are the best sources of vitamin D in the diet. Vitamin D tablets can be beneficial for persons who do not get enough sunlight. Vitamin D is essential for bone health and has also been related to immunological function and cancer prevention. The following are vitamin D blood levels guidelines. 1. Sufficient: 20 to 30 nanograms per milliliter, or 50 to 75 nanomoles per liter. 2. Safe upper limit: 60 nanograms per milliliter, or 150 nanomoles per liter. 3. Toxic: above 150 nanograms per milliliter, or 375 nanomoles per liter. A daily vitamin D intake of 1000 to 4000 IU or 25 to 100 micrograms should be enough to ensure optimal blood levels for most people. Number 3. The amount that is considered to be too high. It's difficult to set an exact threshold for safe or hazardous vitamin D intake because so little is known about how vitamin D toxicity operates. The Institute of Medicine recommends a daily vitamin D consumption of no more than 4000 IU. In healthy people, however, dosages up to 10,000 IU have not been demonstrated to induce toxicity. Excessive vitamin D supplementation, not food or sun exposure, is the most common cause of vitamin D toxicity. Although vitamin D poisoning is rare, recent increases in supplement use may have increased in cases recorded. Humans have been demonstrated to be hazardous at doses ranging from 40,000 to 100,000 IU or 1,000 to 2,500 micrograms per day for 1 to several months. In repeated dosages, this is 10 to 25 times the recommended maximum limit. Vitamin D toxicity is defined as blood levels of more than 150 nanograms per milliliter or 375 nanomoles per liter. Several examples have also been reported where manufacturing errors resulted in supplements containing 100 to 4,000 times the amount of vitamin D listed on the packaging. These poisoning instances had blood levels ranging from 257 to 620 nanograms per milliliter, or 644 to 549 nanomoles per liter. Although vitamin D overdose is normally curable, severe cases can lead to kidney failure and artery calcification. Number 4. Symptoms and treatment of vitamin D toxicity. Hypercalcemia, or a buildup of calcium in the blood, is the most common symptom of vitamin D poisoning. Nausea, vomiting, diarrhea, constipation, and weakness are among the early signs of hypercalcemia. Excessive thirst, altered levels of consciousness, elevated blood pressure, calcification in the kidney tubes, kidney failure, and hearing loss are all possible complications. Hypercalcemia caused by taking large amounts of vitamin D pills regularly can take months to resolve. This is because vitamin D is stored in body fat and released slowly into the bloodstream. Avoiding sun exposure and removing all food and supplementary vitamin D are all part of the treatment for vitamin D intoxication. Increased salt and fluids, as well as intravenous saline, may be used by your doctor to adjust your calcium levels. Number 5. Large doses can be harmful, even without symptoms of toxicity. Even if there are no obvious symptoms of toxicity, large dosages of vitamin D can be dangerous. Vitamin D is unlikely to induce severe poisoning symptoms right away, and symptoms may appear months or years later. One of the reasons why vitamin D poisoning is so difficult to diagnose is this. There have been stories of persons taking extremely high doses of vitamin D for months without experiencing any side effects, although blood testing revealed severe hypercalcemia and renal failure signs. Vitamin D's negative consequences are complicated. Hypercalcemia without toxicity symptoms can be caused by high doses of vitamin D, but toxicity symptoms can also be caused by high doses of vitamin D without hypercalcemia. To be safe, do not exceed the upper limit of 4,000 IU or 100 micrograms without visiting a doctor or dietitian. Is vitamin D tolerance affected by the intake of other fat-soluble vitamins? 2 other fat-soluble vitamins, vitamin K and vitamin A, have been suggested to have a role in vitamin D poisoning. Vitamin K serves to regulate where calcium goes in the body, and too much vitamin D can deplete the body's vitamin K levels. By conserving the vitamin K reserves, a larger vitamin A diet may help prevent this. Magnesium is another nutrient that may be significant. It's one of the nutrients that can help you get better bone health. As a result, combining vitamin A, vitamin K, and magnesium with vitamin D may help to improve bone health while also lowering the risk of calcification in other tissues. Keep in mind that these are only theories, but if you're going to supplement with vitamin D, it's a good idea to be sure you're getting enough of these nutrients. Number 6. Take-home message. High dosages of vitamin D have varied effects on different people. As a result, determining which doses are safe and which are not is difficult. Vitamin D poisoning can have serious health consequences that may not manifest for months or even years after high dosages have been taken. In general, exceeding the top limit of safe intake, which is 4,000 IU or 100 micrograms per day, is not suggested. Larger doses have not been related to any significant health advantages, and hence may be unneeded. A high amount of vitamin D is occasionally used to correct a deficiency, but always check your doctor or dietitian before taking a significant dose. More does not always equal better nutrition, as it does in many other areas.